Good morning, everybody. I'm going to reconvene the Monterey County Board of Supervisors on our public agenda items. Can we get a roll call, please?
Good morning. Let the record reflect all supervisors are present, with Supervisor Parker, Alejo, Phillips, and Adams appearing via video conference, and Chair Supervisor Lopez appearing in person.
Mr. McKee, do you mind leading us in the pledge? Announcement of the interpreter, please.
Buenos días, mi nombre es María y estoy aquí para los servicios de intérprete en español.
Do you have any additions or corrections, Madam Clerk?
There are no additions and corrections.
I believe we were going to be pulling one item from today's
I wanted to pull the item, and I'm sorry I don't have the number in front of me, related to the BMX referral from Supervisor Alejo. Item number 13, there it is. And we're going to be removing that from the agenda, and we'll bring it back at a future meeting.
Okay, so I've got a removal of 13. Can I go ahead and get a motion for that?
So moved.
Second.
I've got a motion from Alejo, a second from Phillips. Any public comment on the removal of that item from the agenda? Seeing
Mr.
nobody
Chair?
coming forward. Yes,
Mr.
Supervisor Alejo.
Just on this item, I would just request from RMA staff on a referral that is made by a supervisor, that if they're going to put it on the agenda, they could at least consult the person, the supervisor who made the referral. And the reason is because the last time we voted on this, we had just voted that if an opportunity arose in the future where we could seek funding and partner with the city of Salinas, we would bring it back. And otherwise, we don't need any action on this. So meanwhile, my staff and I are working to get information from the County of Santa Cruz and City of Watson that have done recent projects and how they funded this. And then if an opportunity arises, we will bring this back. But in the meantime, let us do that work. But we would appreciate it if RMA staff could at least consult me before bringing this back, when it was certainly not ready and the timing is not right with everything going on. Thank you.
Thank you, Supervisor. So with that, we have a motion and a second. We've gone to public comment. Can we get a roll call vote, please?
Supervisor Alejo,
Yes.
Supervisor Phillips,
Aye.
Supervisor Parker,
Aye.
Supervisor Adams,
Aye.
and Chair Supervisor Lopez.
Aye. Motion carries. Thank you. We have our additions and corrections. We'll head into our consent calendar next. Is there a supervisor who'd like to pull an item from consent? All right. I'm not seeing any. So with that, I'll see if there's anybody from the public who'd like to pull an item from consent. Seeing nobody in chambers. If you're participating via Zoom, we ask that you use the Participants tab. If you go to the bottom of your screen, click on Participants. At the very bottom, there's a raise hand function. If you click that, it'll let us know you want to be recognized. If you're participating via phone, *9 will do the exact same thing and let us recognize you to pull that item. So I'm going to give you just a second. Is there anybody in the public who'd like to pull an item from the agenda?
Move consent.
Got a motion for consent?
Second.
Second. Motion Alejo, second Phillips. Roll call vote, please.
Supervisor Alejo,
Aye.
Supervisor Phillips,
Aye.
Supervisor Parker,
Aye.
Supervisor Adams,
Aye.
and Chair Supervisor Lopez.
Aye. Motion carries. Thank you very much. That'll wrap up consent. We'll head into ceremonial resolutions. Any public comment on ceremonial resolutions? Seeing none, I'll bring it back to this board. And I'd like to make the motion, just because I put this resolution forward, and I think it's pretty cool to have a World War II vet at 100 years here in Monterey County. We'll be recognizing that at another event for Mr. Corda, but I'll make the motion if I could get a second.
Second.
Okay, I'll take the second from Phillips, and roll call vote, please.
Supervisor Alejo,
Aye.
Supervisor Phillips,
Aye.
Supervisor Parker,
Aye.
Supervisor Adams,
Aye.
and Chair Supervisor Lopez.
Aye. Motion carries. Thank you so much. We're through ceremonial resolutions, and we're going to head down to appointments. We have 3 of those. Is there a member of the board who wishes to pull one of those? Okay, seeing none. Anybody from the public? Seeing none, I'll entertain a motion to move appointments.
So moved.
Second.
Motion from Adams, second from Phillips. Roll call vote, please.
Supervisor Alejo,
Aye.
Supervisor Phillips,
Aye.
Supervisor Parker,
Aye.
Supervisor Adams,
Aye.
and Chair Supervisor Lopez.
Aye. Motion carries. That takes us through appointments. And we're going to jump into other board matters, which we'll start with board comments, and I'll go to Supervisor Alejo first.
I don't have much to say, but I did want to take an opportunity to wish all our fathers out there happy Father's Day. It's going to be celebrated this Sunday. Usually when we're, especially during these times of crisis and with all these health concerns, it makes each Father's Day or each Mother's Day even that more special. So I want to just do a shout out to all our fathers that are part of our county family, but also all our families out there in our communities to wish them well, and I guess to however they celebrate, to do it safely and social distance and always possible. So I think that's all I have to report today, Mr. Chair. Thank you.
Thank you, Supervisor Alejo. Supervisor Phillips.
I pass. Thank you.
Supervisor Parker.
Thank you, Mr. Chair. I just want to thank Ezekiel Vega for being present at our virtual Hot Topics last evening to present the recommended budget, to go over that with the participants, and the people in the meeting had some very detailed questions for him, and also some big picture questions. It seems like people are very much aware of the kinds of priorities that we're weighing, how to not only keep our communities safe, but also healthy and thriving. And they're looking at ways that we can invest in our people and in our communities to make that happen. So I appreciate him being there and fielding all those questions and comments. And then just wanted to also thank Supervisor Adams for participating together on the Personal Services Virtual Town Hall last Thursday. People were very engaged and interested in when they were going to be able to reopen. So I hope that what we were able to offer in terms of where they could find information to get prepared we hope that was helpful. And then I think it was later that evening that we got word that the state was going to allow nail salons, tattoo shops, massage therapists to get back to work later this week. So I felt like the pleas of those participants were heard at the state level. So that was great. And then I do have a question that maybe can be addressed when we have our COVID-19 update. I had the impression that our public health officer was going to maybe update the shelter-in-place order to specify that these services were going to be allowed, or whatever is going to be true in our county. But I don't know if I'm correct about that. So if we could get clarification, I would appreciate that. Thank you very much.
Thank you, Supervisor Parker. Supervisor Adams.
Thank you very much, Mr. Chair. I also, for the Town Hall on Personal Services, want to thank Elsa and Les and Nick for the help that you gave us to make that a successful event. We also had another town hall called the Road to Recovery. We're all in it together. And I want to give a shout out to the participants that we had for that, which were Janine Chicarat, David Fink, Dr. Gerald Taplin, Danae DiBenedetto, and Rob O'Keefe. Clyde Mayor Roberson was there as well. It was very well attended, and I think was really an important step forward as we look to reopening things. I also want to mention, in line with that, that there has been a very prestigious award given to the Cannery Row Company, Sardine Factory, and the Inns of Monterey. They've received the Safe Travels Award from the World Travel and Tourism Council. And it's a prestigious award that really has a lot of meaning today, because it recognizes the protocols and guidelines for restarting operations and focusing on best practices for cleanliness and hygiene and fulfilling all the requirements outlined by the health authorities. So while I did not have time to get a resolution put forward for my entire colleagues on the board, next week I will come back with a board-wide resolution for that, but I did just want to mention it since it had just happened. Additionally, the City of Monterey is celebrating its sesquicentennial, which is its 250th anniversary. The City of Monterey was founded by, or established, I should say, by Gaspar de Portola on June 3rd, 1770. It established the Presidio of Monterey that we all know, and also the chapel, or the cathedral at San Carlos. The area was originally founded or settled by the Costanoans. And in 1542, Juan Cabrillo was the first one to see it. And then in 1602, Vizcaíno named it Monterrey after the viceroy of New Spain, which was actually Mexico. So sadly, the city is unable to do all of the festivities that had been planned for its 250th anniversary. And it has decided to move to at the 251st anniversary. There was a virtual program, but I don't think it's the same as the opportunity for people to gather together and enjoy it. And then finally, I just want to say that Friday, June 19th, is Juneteenth, which is also known as Freedom Day, celebrating the final emancipation of slavery. It took 2 years after the Emancipation Proclamation abolishing slavery was signed for this information to reach the state of Texas. In Galveston, Texas, on June 19, 1865, Union Army General Gordon Granger read the federal orders that all previously enslaved people were free. Many African-American people celebrate this day as the Day of Freedom. So those are my comments. I want to go back for a second, though, to the City of Monterey. I know I've been chatting with Supervisor Alejo about this, and I don't know if he wanted to make any comments about the Monterey sesquicentennial or not, but I wanted to make sure I had that, if he had that opportunity, should so choose.
Thank you, Supervisor Adams. I think it's unfortunate in this crisis that Monterey County, I think as a whole, cannot celebrate this rich and long history of the city of Monterey, the first capital of California under Spain and Mexico. So it was kind of the Merienda celebration in Monterey is probably one of the best celebrations or parties anywhere in the county. But I guess we'll have to hold off for next year. But I think there's a real good story to tell about the different waves of immigration, of different peoples coming. And so it's a real celebration of diversity and a history that really pioneered many things. I think the first library, the first public schools, the first newspapers, all started in the city of Monterey, first theater. So it's these special moments that during this crisis that we could remind our citizens that there was a lot of firsts that happened right here in our county. Our county originally started with San Benito. It was a much bigger county. It split off later, but it's a source, I think, of pride for our young people, our community residents, to know that there's a really profound history to be proud of here. And even when I do our young supervisors program, I take them to Colton Hall. I take them to the oldest government building, the Custom House, where a lot of the first things happened in the state. So I really see that this as I know it's not my district, but I take pride in the local rich history, but also to inspire our young people and our families that Monterey County is not only a beautiful place, but a place with such a history that I think we could all be proud of today. So I look forward to that celebration months down the road, Supervisor Adams, and I look forward to partnering with you on that resolution to celebrate this tremendous history of the city of Monterey.
Thank you, supervisors, for the awesome history lesson. I know every year when I go to the rodeo, they call out that history of who came to Monterey and in what line and what order and who conquered and who. And so to have that remembered here in the chambers and put on the record is extremely useful, and we're thankful for that incredible history lesson, and we look forward to that resolution. I know this Father's Day, for me, it's coming. It's going to be this Sunday, and it's going to be my first, and I just want to make sure everybody knows that we need to do it in a safe way. I know that things are opening up, and it feels like coronavirus isn't out there anymore, or maybe it's less of a concern, but it's still extremely real, and it's still extremely present in our community as we continue to see increases. So please be very cautious. It's an opportunity for us to do it the right way. I know we had an increase after Mother's Day, so let's not repeat that. Let's do our best to keep one another safe. I did want to share that on July 15th, I'll be hosting a town hall meeting to address the Southwest Salinas corridor, which is from the Firestone Business Plant almost down to Chular, where we've had an incredible amount of deaths over the last few years with the at-grade crossing. We've been working closely with the coalition along with Caltrans to talk about that corridor and what can be done to improve the safety through there. And it's culminating with a large town hall where we're hoping people will share their concerns so that we can record those and come forward with solutions. But again, that'll be July 15th, and more information will be forthcoming. It will be via Zoom. It will not be an in-person town hall. It will be a digital town hall, so we encourage people to participate, share your concerns, thoughts, and maybe some of your solutions you might have in your thoughts for us to be able to come up with something that works for all of us. Lastly, I want to thank PG&E. Yesterday, there was an accident on Valletta Road in the morning, and when a truck veered off the road, hit a pole, and that pole crossed another line, sending a surge of energy into the community of Chular and northern Gonzales. That outage is ongoing. We still have about 150 customers out of power, but I can tell you that in light of COVID and the fact that, unfortunately, Chular has taken the brunt of quite a few different unfortunate happenings, which started December 5th with the flooding that most of us still remember, and we still don't have a signature from the governor on our emergency declaration there, and that school lost the only outdoor recreation facility it had, which was a soccer field. Unfortunately, that field has been was destroyed December 5th, and we haven't been able to help them recoup that funding to replace that facility. And this isn't the first time the lines got crossed, and unfortunately about a year and a half, 2 years ago, the community lost about 140 refrigerators as well as TVs and other electronic appliances. And so this, again, happened yesterday, and I want to thank PG&E because this time they responded extremely quickly, putting boots on the ground. They've had teams on the streets knocking on doors and making sure that people have the ability to charge medical devices and phones. And so they've responded extremely quickly. They're on the ground in Chular, and we want folks to know that we're watching closely and that we're asking PG&E to speed along any services that they might have to make sure that the impact is less on that community in Chular. So just, again, want to thank PG&E for their incredible help in that community today and yesterday, and know that as we move forward, we'll continue to advocate as hard as we can for our little community of Chular. And with that, that's the end of my comments, and I'm going to turn to our CAO for any comments or referrals.
There are no comments this week, Mr. Chair, and no new referrals, but I do have a correction to the referral matrix that was submitted in the agenda, and we've provided a corrected one to the clerk of the board. And it's items, referrals 10 and 14. 10 was review of the state and county defensible space regulations. It's just in there. It's just a correction to when staff would be coming back for a presentation to the board, and that'll be on in July 2020. And then on 14, the referral on the Big Sur roadside camping prohibition, just a correction that a memorandum on the matter was provided to the board on June 2nd. So I just want to have that correction in the record.
Thank you, CAO McKee. At this point, we're going to open up for general public comments. I'm going to be in the chambers first, and then I'm going to go to Zoom. So again, for those participating via Zoom, we ask you to use the raise hand function. It's at the bottom of the participants tab, or *9 if you're participating via phone. All right, we'll start in chambers.
Good morning. My name is Eric Peterson. At the last meeting, in a moment of frustration, I brought up the uselessness of these devices. And you may have noticed a little excitement here to get hearing amplification for just 2 people. the first one of these I was given was dead. I have prepared a letter for the chair that says a lot more than I'm going to say right now. The committee meetings of the supervisors, there's no hearing amplification. Parks Committee, I quit going because there was no amplification. This is bad. We got a lot of disabled vets around here. Right now, I'm going to get rid of this. Right now, I've got this on the highest volume, and I've got my VA issue hearing aid on also. And I've only got 10% disability. What is somebody with a really serious hearing disability going to do? Or maybe just a little bit worse than mine. And so I'll leave the letter on kind of a related issue. Oh, I understand from the county clerk that you're going to be looking at the hearing. These things are junk. They've been junk for years. Getting good things like this would really be helpful. On the related issue, when we were trying to get these things to work, I mentioned that somebody who has been a regular speaker here, who also had hearing issues, Joe Vieira, died in April. And it would be nice, as much as I disagreed with Joe very often and on just about every issue, as much as I disagreed with him, I appreciated his dedication to trying to make the world, in his mind, a better place. It was kind of like, I may not agree with you, but I'll defend to the death your right to say it. Thank you.
Thank you, Mr. Voltaire. Mr. Peterson, we appreciate your comments. Is there anybody else in chambers? Seeing nobody coming forward, I'll look once more to the Zoom. And I see no hands up. So with no hands up, we will go ahead and close public comment and bring it back for our 10:30 scheduled matters, which will begin with a briefing on COVID-19. And I see Mr. Chulos.
Good morning, Mr. Chairman and board members. We have two items to bring up with you today. The first is a presentation by Christy Mishi and Dr. Moreno about test results and monitoring metrics. And then the second will be about the costs of responding to the COVID emergency, and that'll be handled by Sean Ellerby, Gary Millay, and Becky Cromer from DSS. Thank you.
Good morning, board members. Dr. Moreno here. We have a presentation to share with you. Charles, is the presentation going to be loaded up over there?
So normally the participant should have it, but if you send it to the clerk's office, I don't know if it'll be should be over on the system here.
All right.
Or you can share screen if you want to.
Let me see if I can share screen. Is that showing up?
No.
Not yet.
Not yet.
Now?
Nope.
One second,
Let's
IT's
see if we
working
can
on
find
it.
it here. Hey, Nick. The other one first, maybe? Why don't we, Dr. Moreno, why don't we move to the cost item first, and then we'll come back to you.
So I think Christy Mishi's going to pull up the presentation.
Okay, we're going to go with the cost presentation first, and we'll come back right after for.
Okay.
Thanks, Dr. Moreno.
Gary, are you gonna start?
Yeah, okay. I didn't know I was on. Can you hear me?
Yes.
I need to be unmuted if you can't hear me.
We can hear you.
Okay, thank you. So, is our presentation be brought up?
Yes, we have it here. Hold on one second.
So honorable board members and public, what we have for you on the costs broken down into two areas. The first area that I'll be not only current but projected for our housing sites to reduce the spread of COVID. And then Sean will add to that some of the additional costs that are in the EOC to manage disaster. So regarding the cost, the three slides I have up, the first one here shows you all of the different alternative housing sites and the real-time costs that you can see. The thing that I'll point your attention to is that on this screen, we have 9 hotel sites that are on contract with the EOC right now. Only 3 are occupied. Of those 9 hotel sites, 2 are in Marina, 3 are in the city of Monterey, 2 are in Salinas, 1 in King City, and 1 in the city of Carmel. We have 2 large
Shall I fill in the blanks? So we have 2 large facilities that currently that we're setting up. So predominantly the hotel in Marina we're using as an alternate housing site, as well as the Monterey Fairgrounds that we.
At this chart, most of our costs, even though we were activated in March, came to, oh geez, I lost. Can you still hear me?
You're in and out, Mr. Millay. Is it okay if we just have Shawnee Ellerby fill us in on some of those details? Go ahead.
Good afternoon, Chair, Supervisor Sean
I
Ellerby. So before you today on the slide, let me explain what you're looking at. You're looking at a projection or a forecast based on how we've been providing services across the alternate housing sites that we've established. As Mr. Millay had indicated, we have a housing site set up in Marina, Monterey Fairgrounds, Sherwood Hall and Salinas is underway and then projected to be stood up. And we also have a couple other hotels, one in Monterey. We have San Lorenzo Park where we have trailers, as well as some testing sites that we've set up. So what you're looking at is really a forecast, how we've been deploying the services based on the planning that has gone through the EOC and standing up these facilities. And so as you can see through the columns, just sort of how we've been spending the money going across, what we're projected to spend at each of these locations for a total of right now, through the end of September, we're just looking at $4.5 million. I think that's optimistic, assuming that this event doesn't extend beyond September. Next slide, please. And so the next chart that you're seeing is just that $4.5 million, again, going through by month where the expenditure increases have occurred for each of the locations. So just another depiction of those costs. Next slide, please. This slide also is again just looking at the dollar values by month and what's projected for the care and housing sites. Next slide, please. Okay, so the updated presentation wasn't provided. Is there a way to put it on the projector?
So while they're pulling that up, I would just add into what Shawnee was saying is that some of those costs, as you see projected out, will come to realization and some won't, depending on need. There will be some housing sites that won't be needed and potentially alternative care sites. So we just recognize that some of those will be needed, but we just want to make sure that the projections are there just in case. But we know, we're pretty, confident that some of them will not be needed at this time at least. If additional housing sites are needed in the future, because of any increase in the coronavirus, then we would look to ramp them up.
Correct. So the slide that you're seeing in front of you right now, there's some questions about really what the process was and submitting applications through FEMA for the reimbursement process. We submitted our request for public assistance. As you can see, that's the third box in on the slide in front of you. In addition, we did put through a streamlined application for $3.4 million. That was just to get expedited funds in advance. And so of that 3.4, what we would be looking at is 50% of the 75% that FEMA would be potentially eligible for reimbursing us, which equates to about $1.3 million. So we did get some questions back from FEMA or Cal OES regarding that application. Those responses were provided, and they are still in the process of reviewing that application. But in addition, there'll be multiple public or project worksheets. That's what the PW stands for in the fourth box. And those project worksheets enable us to break down the costs as we're incurring them and then submit separate projects, if you will, to FEMA for reimbursement. And then obviously they'll go through the review of all the documentation. Once they concur with the costs and we provided all the supporting documentation, we'd go into that sign of the final grant and then receive the funding. And so that's the process that's been stood up in case there's any questions. And so there's been dialogue. One of the things that we've done working with the ARDA controller and ITD is getting 2 special reports created for the EOC. And the nice thing is that these reports will actually be available for future events, not just this event. But one of them is to essentially provide all the salary and benefit information and the benefit information, which is really important. So it comes into a format that we can provide easy access into our project worksheets and submit that information up to FEMA for reimbursement, as well as a cost spreadsheet that shows all the costs, including the labor. And what we've been reporting to you has really just been the expenditure side, the purchases, not the labor component of it, as we're still waiting for this report. But what I do have for the total, so right now, currently what we've seen in these reports, the salary and benefit expenditures, the actuals has been $4.5 million, of which, because most of our labor is what is deemed as forced account labor, is not going to be eligible for reimbursement. A portion of it will be, and that portion would include any kind of staff costs that we've had that were funded by grants, and that funding essentially would have been spent had the staff had stayed deployed working on those grants, but instead if they got reassigned to support the EOC, then we would get reimbursement for that. So public health has already informed me that there's about $1.3 million of that $4.5 million that is reimbursable because that's staff that would have worked on these grants. Also, if we had incurred additional expenditures by bringing in temporary staff, those costs would also be deemed eligible for reimbursement. There's also a 5% management reimbursement for this event that would also qualify for us recouping some of those dollars for salary and benefits, in addition to any overtime that we might have incurred. And so those are really what we're looking at, is getting reimbursed on the labor side of the house. The expenditures, as long as they meet the definition of what's been eligible by FEMA, we should also be looking to get those costs reimbursed at the percentage of 75% from FEMA. And right now, if I looked at what we expended to date and expenditures, it was almost $1.2 million is what we've incurred today on just expenditures. And that includes the $500,000 that the board allocated to the food bank. So that's a good portion of that, those costs. We're working with each of the county departments of identifying all their expenditures because they've also incurred things, and I'm reporting for everybody. And then once we get the backup for that, then we'll be starting to make our project worksheet submissions to FEMA for reimbursement. Any questions?
Any questions from board members? Okay, no hands up. Any questions from the public on this presentation? Oh, Supervisor Adams, are you using the old school hand raise?
I am. Thank you so much. I did just have a question, Sean. This does not include any of the hotels that are being used by the Grower Shipper project?
It does not.
Okay, and if we were to think of the countywide cost of all of this, whether it's us or someone else, any guesstimation of what that additional cost might be?
Well, I don't have what would be their costs, but if
Uh-huh.
I was looking at what we've incurred to date and what we're projecting, we're looking at $11.6 million. And
Okay,
that's to date. So I'm not, and my numbers and the projections do not include the staff labor, only the actual staff labor that I just reported, the 4.5 million.
okay, good. Thanks very much. Good report.
You're welcome.
Thank you.
See no other hands. We appreciate the presentation, and I can tell you that over the short time that I've been an elected official, I was lucky enough to go to training pre-COVID. And the one thing stressed to us through that entire training is the critical component that you as a leader of a elected body or agency have to be mindful of is the budget, and be mindful of tracking your expenditures so that you can apply for reimbursements when the time is appropriate. And Sean, from the outset of this crisis, you've stepped up, you've been there, and I want to thank you personally. I know it's not easy. I know there's a lot of people, and you have an entire team around you, so to you and your team, thank you so much for tracking these numbers, because to have the best shot at recouping those dollars, which turn into services for our citizens here in Monterey County, is to have it properly tracked, and we know that you're doing that. So thank you for your efforts.
Yeah, thank you. It takes a village.
Thank you. All right. We're going to jump back to Dr. Moreno now. Dr. Moreno.
All right, is it showing up better?
Yep, we got it now.
Excellent. Okay. All right. Good morning, board members. So this is Dr. Moreno, Ed Moreno, Health Officer, Monterey County, and providing an update on public health efforts to contain COVID-19. We have, as of June 15th, just surpassed 1,000 laboratory confirmed cases of COVID-19. And we have identified and contacted nearly all of the 3,865 close contacts. We're still consistently 97 to 98% of cases are contacted and instructed on how to isolate and ask if they need any support. And about 97% of the close contacts that are identified are reached, and similarly instructed on how to quarantine safely. We have a total of 87 hospitalizations and 12 deaths in Monterey County. This is just a depiction of the cases. This is the number of cases over time are the orange bars, and then the green line on the bottom represents hospitalizations over time. This is a map that Christy Mishi's been able to put together, which shows the cases, or it's a case rate. And the way it's depicted is by zip code. The red color represents higher or highest rate of COVID-19 in the community. It's per 100,000 population. And so the areas in Monterey County that currently have the highest rates include East Salinas, the area of Gonzales, Greenfield, King City, and south near San Ardo. So those are the highest rates that we're seeing. And we're able to get this data because we have, as you know, testing here in Monterey County to confirm cases. We have several areas where people can get tested. We have of course, our Monterey County Public Health Laboratory, which typically receives specimens from the local hospitals. The hospitals themselves have testing capacity and capability. Commercial labs are receiving specimens as well from hospitals and healthcare providers. And there is a surge capacity in the laboratory system in California, which includes University of California, San Francisco, I believe Stanford, and the California Department of Public Health Viral and Incredible Disease Laboratory. There are also some out-of-county hospitals that are performing the test as well. And specimens have to be collected in order to run the test. So our hospital emergency rooms continue to collect specimens. We have the Optum sites, 2 of them in Monterey County that you're aware of. Planned Parenthood has provided some testing as well. And more of our primary care clinics are exploring and implementing testing as well. So that's a big plus to the testing capacity here in Monterey County. We have, excuse me, we have a graph here, a chart here of testing, and to the left, you see the different laboratories that are groups of laboratories that are doing testing for Monterey County residents. And Monterey County Public Health Laboratories at the top, and we have a total of 4,627 tests that we've performed at the laboratory. The commercial labs, there's several commercial labs combined. They are now providing the total number is 7,647. And then our hospital laboratories have really contributed tremendously to the total number of tests that are being performed. Our public health, our hospitals have the quickest turnaround time because the specimen gets taken from the patient and it's taken to the lab, conducted immediately at the hospital for quick test results. And we're second, meaning we're usually within 12 to 24 hours, we can get test results back to the hospitals if they want to submit it to our laboratory. We've been reporting on test positivity rate, and that is the total number of positive tests divided by the total tests that are performed. And we were up to as high as I think 12% several days ago, but this is tracking over 7 days and 14 days. And over the last 7 days, 9.2% of tests that are submitted and run in laboratories are coming back positive. Over the last 14 days, it's been around 10%, but it's slowly coming down from about 12% not too long ago. Total, since we've been in this, is about 6.6%. And I did mention that from time to time, the positivity rate will go up, and it did, and it's coming down a little bit now. This is another graph, and this reflects the testing rate. So this is number of tests that are being performed per 1,000 population over time. And we can see that the areas that are green actually have a higher test rate. So there are some South County areas that are doing well with testing. Some pockets in the near the peninsula and parts of Salinas as well. Where we're not getting, red is where we're the rate of testing, meaning the number of tests per 1,000 people, to compare from one region to another, is lower and further, we go further south in the county and also in North County. And so this is one of the things that we're looking at and and exploring whether there are some additional strategies that we need to implement to try to increase testing throughout the county. So we'll continue to track this over time. This is a summary of our public health activities. We continue to monitor the metrics and the public health indicators. We continue to support our hospitals with laboratory testing supplies, for example, and also through the Mohawk Medical Health Operation Area Coordinator, working to provide personal protective equipment to the hospitals to make sure that they have at least 14 days of supply on hand. And we're working with the hospitals to support our skilled nursing facilities to try to prevent cases, and if they do get cases in their residents or their employees, working with local hospitals to increase testing. And they are also working on plans, protocols to do surveillance testing as required by licensing and certification at the state. We are continue to encourage testing and do what we can to help with testing. We continue to do a very good job with case investigations and contact tracing, and also continue to promote the mitigation strategies such as physical distancing, covering our faces, washing our hands, staying home as much as possible. Just a little bit of information on the roadmap to recovery, or the resilience roadmap. There's, as we all recall, 4 stages, and we've passed the first stage, which was only essential services and essential travel. We completed stage 2, which is lower risk workplace and activities, and now we're in early stage 3, where the state is releasing guidance, we look at our indicators and metrics, and the state looks at, they're also tracking indicators statewide prior to deciding to allow additional business sectors to open up using state guidance. And then the stage 4 will be the larger event venues where hundreds of people will gather, and it's got the highest risk of clusters and outbreaks because large events like this bring people from so many different households together, and transmission can occur quite easily when you bring that large groups of people together from different households. So we're not in stage 4. And this may look familiar. Elsa Jimenez has shared this before. I think the top hasn't changed very much. The green box, except for the green box on the right, June 12th, we entered into early stage 3, but the yellow boxes have changed. And on the right, you can see early stage 3. These are the business sectors that have opened up, and there is an additional business sector, which is called, I think, personal services, which includes nail salons and body artists. They're included there, and that guidance has just been recently released by the governor, with a opportunity for various counties like ours to open those services no earlier than June 19th, I believe. I mentioned the local indicators. There are 4 groups of indicators. We are tracking our ability to test, to do contact tracing, to isolate and support those that have been exposed and who are in quarantine. We're also tracking indicators that monitor our ability to protect individuals at high risk for complications of COVID-19. We have additional indicators that track our hospital and healthcare system surge capacity, and also our ability to conduct epidemiology and surveillance of COVID-19 in our county. Put this up for everyone to see. Again, these are the telephone numbers you can call to speak with someone from 8 to 5. If you have questions about COVID-19, you can call that number Monday through Friday. We welcome people to call us, and we'll do what we can to answer your questions. So that's my update for today, Supervisors.
Thank you, Dr. Moreno. Can you take us back to, I think it was your 2nd or 3rd slide?
Okay.
It was a very data-rich slide.
Okay, I'm sorry, which slide, Supervisor?
Keep going. That one. Go forward. I think there. Nope. Not that one. The one before. That one.
Yes, sir.
I thought that was a great visual. I'm going to turn now and see if any other board members have questions. Any questions from board members?
Yes.
Supervisor Parker, I see your hand up.
Thank you, Mr. Chair. Dr. Moreno, is there anything that you can tell us at this point about whether you are preparing an updated shelter-in-place order to give guidance to the personal services folks who may be allowed to open this Friday, or do they just follow state guidance and go forth and prosper?
Supervisor Parker, I can begin to answer the question, and I know County Council would also want to weigh in, but the way the most recent order is written, it's written such that as the state continues to move through stage 3, Monterey County can follow the state through stage 3 and also through stage 4. So as there's a new guidance that just came out, and the health officers, the state has asked that the health officers review our local indicators and consult with the Board of Supervisors, and then make a determination as to whether or not circumstances will allow the county to move to the next, to allow the next sector to open up.
Great, thank you.
Let me add to that, Supervisor. Yeah, we intentionally constructed the most recent shelter-in-place order so that Dr. Moreno would not have to keep issuing new orders. So it is designed to follow whatever the state guidance is as we move through the stages, with his announcement, if you will, that the metrics are good enough to reopen the additional sectors. In addition, he did recently issue a supplement to his shelter-in-place order requiring all business sectors to follow the appropriate state guidance. So with those two orders in place, he doesn't need to keep issuing new orders going forward.
So the personal services folks can go to the guidance, the state guidance about what they need to do to train their employees and all the precautions that need to be taken. And when Friday comes, they are good to go.
Well, they should go and get ready. Dr. Moreno still has to indicate that the metrics are sufficient to allow those sectors to open. But provided he does that, then yes, they'd be good to go on Friday.
Great, thank you. That's what I was trying to figure out. Are they good to go, or are we waiting for something? So we're waiting for something. Perfect, thank you.
Excuse me, Supervisor Parker. The order also states that the business sectors, excuse me, that the business sectors have to follow health department guidance should we issue it. And so a good example of that is the Environmental Health Bureau in the health department does issue specific guidance for regulated businesses that are reopening. So they would need to follow the state guidance and also health department guidance.
Got it, thank you.
Supervisor Adams.
Thank you. Dr. Moreno, I heard on the news this morning that there have been new cases of COVID-19 discovered now in Beijing after having gone for weeks and weeks and weeks with no cases at all. And I was just wondering whether there has been any kind of a flurry of discussion among your colleagues around the state or the country with this new information. I mean, sadly, it does not bode well.
So we haven't, thank you, Supervisor. Actually, not recently. We haven't had any discussions recently, but this is, again, it's a new virus and we're still learning about it. And as restrictions open up across in many countries, so does travel. And so there may be a component of travel, people who are traveling from a part of the world that still has a high rate of COVID-19 to a place that has already experienced its first wave. And then there might be a component there, but to answer your question, we haven't, but we certainly will. And the other thing is, I believe that there, I think UCSF, and I think the state are testing some of the viruses to see what type of strains there are out there, but I haven't seen any reports out yet. But that could also shed some light on how this virus is spreading across countries and between countries.
Thank you.
All right, seeing no other hands up from board members, I'll go to the public. Any public comment on this? I see Mr. Peterson coming forward in chambers, so we'll turn to him first.
Whoop. Hit the wrong button. Last week, while I was speaking, I offered $500 to Monterey County to purchase face masks for homeless people. Didn't get an answer. Visual aid number 1 is a checkbook. Visual aid number 2 is my pen. I'm ready to write a check for $500. I'll also be here I'm planning on being here for agenda item 1 this afternoon. If somebody wants to get a check for $500 for a face mask for homeless people. This is a powder keg waiting to explode, and I really hope I'm wrong about the chances of it exploding. But we get people who may not really comprehend what's going on. The numbers I've seen on how the percentage of mentally ill homeless is like 75%. That would include things like addiction. Monterey County Health Department's doing an excellent job. There's no doubt about that. But it's like the old blues song, 99 and a half, it just won't do. So, offer's still open. Thank you.
Thank you, Mr. Peterson. Anybody else in chambers? Seeing nobody coming forward, we'll turn to the Zoom. Seeing no hands up via the Zoom, we will go ahead and go back to Mr. Chulos for wrap-up comments.
That is it for today, Mr. Chairman. Thank you.
Thank you. We appreciate that. And now we're going to move on to item.
Oh, real quick, Mr. Chair, just in response to Mr. Peterson's comments, I would see if we can hook him up with the Coalition for Homeless Services or another organization like that, which would be best able to distribute masks that he might be willing to purchase.
Great. Let's make sure that gets connected. And at this point, we're going to consider a resolution. And I believe we have HR here to make a presentation. Kim Moore.
Good morning, Chair Lopez, members of the board. My name is Kim Moore. I'm the Assistant Director of Human Resources. The item before you this morning is to consider a resolution authorizing the issuance of a layoff notice to an impacted employee. So it's one layoff notice that will be issued no sooner than June 18th with an effective date of July 10th. Authorizing the county negotiators to meet with SEIU upon their request, authorizing the Human Resources Department to collaborate with departments for in-placement and, if necessary, out-placement services, and granting the flexibility to withhold the issuance of the layoff notice in the event that there is a resignation or a retirement. And then finally, authorizing the Human Resources Department to add an allocation on loan position. The timing of the layoff will have the employee remaining after the beginning of the fiscal year, so we will need to move him to an allocation on loan in order to keep him on the payroll system. Any questions?
Any questions from board members? Seeing no hands going up, I'll turn to the public, see if there's any public comment on this item. Seeing none, I will bring it back to the board for consideration of this resolution.
Move approval.
Second.
Got a motion from Parker, a second from Phillips. Roll call vote, please.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye. The motion carries. At this point, we're going to recess to closed session. We'll reconvene the Board of Supervisors here in the chambers at 1:30. Thank you very much.